Hello and thank you for joining us. My name is Marilyn Cook, Marketing Manager for Professional Insurance Programs, a division of WDA Insurance and Services Corp. And with me is our Benefits Manager, Christine Nadolski. Chris has been with our agency for almost 20 years, helping businesses with health insurance and employee benefits. Today's show will be discussing ERISA compliance, what employers need to know. Before I hand this off to Chris, I would just like to go over a few items. Within 24 hours, you will be emailed a copy of this presentation. Also, throughout this webinar, feel free to submit questions in the questions area of the control panel, and we'll take time to answer all those questions at the end. And on that note, let's begin.
Hi, good morning. Thank you for joining us today on our webinar. Again, thank you, Marilyn, for the introduction. I appreciate it. Today, we're going to learn about ERISA compliance and the implications of your employer-sponsored health plan. All right, for today's agenda, we're going to introduce what is ERISA. We're going to see why ERISA compliance matters, the key ERISA documents and notices, required distribution timelines, ERISA penalties for non-compliance, best practices for compliance, how professional insurance programs can help, and then, of course, our question and answer section. The introduction to ERISA. ERISA actually stands for the Employee Retirement Income Security Act. It was enacted in 1974 and provides guidelines for managing employer-sponsored benefit plans, including health plans. ERISA's main objective is to ensure that responsible administration of employee benefit plans, protecting the interest of the employees. The law also promotes transparency and fairness in the process. Why ERISA compliance matters? Well, ERISA compliance is essential for employers to ensure that their health plans meet federal regulations, minimizing potential legal risk and financial consequences. Following ERISA guidelines actually helps to protect the employee's rights and benefits, ensuring they receive the information and support they need. This fosters a strong employer-employee relationship. ERISA compliance minimizes the risk of lawsuits and costly penalties, safeguarding the financial health of your company. This also allows you to allocate resources to your other business priorities. Key ERISA documents. There are a few key ERISA documents that you need to supply. So what do you need to supply as a provider or as an employer? The Summary Plan Description, also known as the SPD. The SPD explains the health plan benefits and features in detail, providing employees with all the necessary information. It should be given to the employees at enrollment and upon request. More commonly known, the Summary of Benefits and Coverage, which is the SBC. The SBC offers a concise overview of plan benefits in a user-friendly format. Employers are required to provide it at enrollment, renewal, and whenever changes occur within your plan. The CHIP notice is also a notice that informs employees about potential premium assistance for children under the Children's Health Insurance Program. Employers must distribute this annually. Additional required notices for compliance. The exchange notice or marketplace notice. This explains health care options through state or federal marketplace required under the ACA or the Affordable Care Act. You should distribute this within 14 days of hiring a new employee. Special enrollment rights. This outlines the right to enroll outside of the annual open enrollment. and it should be included in enrollment material. Medicare Credible Coverage Notice. It discloses whether your prescription drug coverage is creditable or non-creditable for Medicare Part D. This is distributed annually and before employees become eligible for Medicare. This is where you see those emails from us coming, CMS requirement, Medicare Credible Coverage Notice. CMS has a big role in compliance. COBRA General Notice. This informs the employee of the right to continue their coverage after losing benefits. Groups of 20 or more will actually do COBRA. Groups under 20 would do state continuation. Basically, they're the same thing. They're just administered, one by the state, one federally. And this is actually upon enrollment and is sent to the employees and their dependents. And of course, the HIPAA privacy notice. This explains how personal information, health information, is used and protected. And this should be distributed at enrollment and annually or every 3 years. There are penalties for non-compliance, and here are the updates for 2025. If you fail to provide a summary plan description, you could be fined 195 days per participant with a maximum of 1,956 per request. Now, if you have a group of 10 employees and they all get in on the bandwagon, that's a lot of money. The summary of covered benefits. Failure to provide this information could land you a fine of $1,443 per failure, again, per employee. And the CHIP notices, failure to provide this information will be $145 per day per employee. Additional penalties for failure to comply with COBRA, HIPAA, and Medicare notices are also within the mix. Now, if you do want to contact us and you have questions regarding where do we find this information, you can contact us at Professional Insurance Programs. We are committed to supporting our employers and navigating ERISA compliance. We can help you. Our team is consistent of myself, Christine Nadolski, and also Wendy Block, a senior account manager. We do partner with third-party administrators to ensure ERISA compliance, and we provide guidance and support for our employers. It's very important that you take the time to investigate your third-party administrators for the ERISA. We do work with 2 very valuable third-party administrators, and we'd be more than happy to provide you with quotes so you can stay compliant and you don't have to worry about an employee requesting information and then turning around and going to the OCI. Unfortunately, disgruntled employees do have a tendency sometimes to want to sock it to them. So contact us for more questions or to discuss how we can help you achieve your ERISA compliance. We're at Professional Insurance Programs, of course, 800-637-4676, info@profinsprog.com, or visit our website at www.insuranceformembers.com.
Thank you so much for that, Chris. That was very informative. I even wasn't aware of all those penalties that employers need to be aware of. Mm-hmm. And you're right, if they have a bigger group, those penalties can really add up quickly and actually put a halt to probably some business activity. We are going to answer some questions that have popped up. So if you do have any questions, feel free to put them in the box and we will get to them. But we have a couple to start off. The first one is, about the special enrollment rights notice. Sometimes we had an employee who, it says here, we had an employee who, when hired, said she wasn't going to take our benefits, and maybe she'll do it later. We told her, she needs to do it open enrollment. When is the outside in open enrollment? When can someone join?
Someone can join at a number of different times. It's very specific and it's regulated very closely by the carriers. So you have your initial enrollment. So when somebody is hired and they satisfy their probationary period, they would then be able to apply for coverage after their probationary period. There's 3 probationary periods that are available. We have the first of the month following 30 days, first of the month following 60 days, and the first day after 90 days. We cannot go past 91 days. So that is when a new enrollee or a new hire can actually come onto the plan. They can also come onto the plan when your policy renews. So if your policy renews in May, we would accept application in April for a May 1st effective date. Anybody who declined coverage, who didn't have coverage, who now wants coverage, and you're going to be renewing that policy, they are able to come on as of the renewal date of your policy. The last time somebody, or the last scenario would be a special enrollment period. Say you're on your spouse's plan and all of a sudden you lose coverage because your spouse's employer says, you know what, spousal carve out, we're not going to supply that coverage anymore to the spouse. If we do, it's going to be an additional cost. They would lose their coverage, or if they lost their coverage completely because of unemployment. That would be a special enrollment period. An individual does have 60 days in which to apply for coverage underneath the group when a special enrollment period happens, and that's an involuntary loss of coverage. And then they do have 30 days after they submit the application to supply the letter, the lost coverage letter from the carrier. Great question. Thank you.
And we have one more. Where do we get these notices and documents that need to be sent out? Do we have to do everything on our own?
No, not necessarily. A lot of times the summary, the SBC, the summary of covered benefits, and the CHIP notices are sent with the renewal for the health insurance. The summary plan description actually is a part of an actual ERISA policy, so that you would get from your third party administrator. But your SBC, your CHIP notice, your COBRA notice, if you do not know where to get that, please contact us. We'll be able to provide you that information. The OCI is a wonderful tool to look up that information as well. They will have the most updated information, obviously, because they are the Commissioner of Insurance. But a lot of times it's in your renewal. We kind of bypass it sometimes because we're looking more so for our premium rates and how they're going up, or what's happening with that plan option. Another great question. Thank you.
And we have one more, it looks like, so feel free to put more questions in there for us. I have a small business and am limited on funds. Do I have to have a third-party administrator?
Any employer who offers a group plan will have to have, or should have, an ERISA compliant policy. Those are available only through third-party administrators. Unfortunately, yes, you would have to have that. Just in case something were to happen, we want you to be compliant. We want to protect you as the employer from fines, but definitely having that ERISA policy will provide all of that compliance that you do need.
So pretty much, Chris, it sounds like that if you are offering group benefits, then you need to have this ERISA policy in
You're
place as well.
absolutely correct.
And-
Anybody who is offering employer-sponsored or employer benefits should have an ERISA policy.
And you and Wendy bring this up and talk to any new potential clients coming in?
Absolutely.
Fantastic. Well, it looks like the questions have slowed down, so we are going to finish that for now. But I do want to thank everyone for joining us this morning, and especially Chris for giving us all this important information. As you can see on your screen, we have our professional insurance benefits team, which is Chris and Wendy. They're here anytime to help you. If you have questions, if you have concerns, feel free to reach out to them. That's what they're there for. So we wish you a great rest of your day. Have a great weekend, and thanks again. Bye.
Thank you.